Hi, I'd like to share a little information with you regarding healthcare in Kitsap County. On July 11, 2023, the Kitsap Public Health Board approved a resolution that identified two public healthcare crises in the county. First, the high cost of healthcare in Kitsap, and second, insufficient access to healthcare services. This is unacceptable. Residents of our county deserve full access to the medical care they need when they need it, without having to worry about being discriminated against based on age, race, ethnicity, gender, sexual orientation, or socioeconomic status. The Alliance for Equitable Healthcare, or AEH, is a group of concerned county residents who represent a wide range of backgrounds and experience. Our primary goal is to bring access to affordable, comprehensive, and equitable healthcare back to our county. This includes access to healthcare providers who may or may not be affiliated with our local hospital. There is no one simple solution to our current healthcare situation. We know there are significant gaps between the healthcare we need and the services that are available, but perhaps even more importantly, no single existing entity has the financial resources necessary to support a robust healthcare system in Kitsap. A county-wide public hospital district, or PHD, could establish the financial infrastructure necessary to ensure sustainable funding for a wide range of medical services. You may be wondering what specific conditions are called out in the resolution adopted by the Kitsap Public Health Board. These can be grouped into four broad areas. First, COVID highlighted a number of existing barriers to receiving necessary and culturally competent healthcare services due to factors such as inadequate insurance coverage and providers who do not accept Medicaid, Medicare, or TRICARE, the current grossly insufficient supply of local providers, and some residents' fear of potential healthcare discrimination due to their gender identity, sexual preference, race or ethnicity, age or socioeconomic status. Second, ongoing insufficient access to healthcare. For example, Bremerton, the largest city in the county, does not have an emergency room or even an urgent care clinic within the city limits. The closure of the Naval Hospital caused additional strain on our already overwhelmed healthcare system. There is a dwindling supply of providers, both hospital-affiliated and independent, including primary care, pediatrics, OB/GYN, dermatology, mental health, and other specialties, as well as insufficient long-term care and mental health beds. Third, there are numerous workforce issues. These include things like staffing shortages, which lead to poor outcomes for patients. Additionally, staff morale is low while employee turnover is high. There are also challenges facing local workforce training programs. And finally, there's the high costs for healthcare in this area. According to data available from the Washington State Department of Health, 5 of the 10 most expensive hospitals in Washington are part of the Virginia Mason Franciscan Health System, and St. Michael is the 5th most expensive hospital in the state. Additional barriers are the lack of transparency in healthcare costs and limited access to charity care. The Federal Health, Education, Labor, and Pensions Committee, or HELP, recently released a report taking a look at major nonprofit hospitals that take advantage of tax breaks and prioritize CEO pay over helping patients afford medical care. Based on HELP Committee majority staff analysis, in 2021, Common Spirit, the parent company of St. Michael Medical Center, spent just under 1.5% of its revenue to provide charity care to patients in need, while its Chicago-based CEO received a salary of $32,012,621. What can residents of the county do? We can work together to form a county-wide PHD that could be part of the solution by offering sustainable funding for a wide range of clinical services. Public hospital districts, or PHDs, are owned and governed by local citizens who tailor the PHD services to the community's needs. Overseen by a board of commissioners who are elected by and responsible to the community, a PHD can expand or enhance our access to healthcare services that we need, such as primary care, OBGYN, emergency medical services, or mental health. It's not required to build or operate a hospital. In fact, a PHD could work with our existing hospital to expand or enhance services offered there. All residents of Kitsap County would benefit from the services a PHD provides. Additionally, creating a county-wide PHD spreads responsibility, lowering costs for all individuals. It also makes entering into contracts with the PHD more attractive to new and existing providers. The PHD would be funded through a variety of sources, as is the case with any other healthcare provider. This would include Medicare, Medicaid, and private insurance. A small percentage of its budget, typically 3 to 5%, would come from a property tax levy. You may be wondering what the cost of that levy would be. Here are a couple of examples for a home assessed at $500,000. If the levy was 35 cents per $1,000 of assessed value, the cost to the homeowner would be $175 per year, or roughly $14.60 per month. A levy of 40 cents per $1,000 of assessed value would be $200 per year, or approximately $16.70 per month. Additionally, Kitsap County does have a property tax exemption program for seniors, veterans, and disabled individuals with limited incomes. Achieving the goal to bring access to affordable, comprehensive, and equitable healthcare back to our county is achievable if we work together. We urge you to get involved in this community effort to improve healthcare.